Hi, everyone. Thank you for joining Geopol's webinar on our new study, which is the financial impact of coronavirus in Sub-Saharan Africa. I'm Roxana Elliott. I'm on our marketing team here at Geopol, and I'm joined by speakers who include Ricardo, our director for Southern Africa, Caitlin, our solutions and project manager, and Joy, who's our client services lead for East Africa. So today we're going to be going through the results from our latest study. And Ricardo is going to start us off by going into why we decided to run this study and a bit of background on Geopol and what we do. All right, looks like Ricardo's having some technical difficulties, so I will just start off. So I'm going to go through just the basics of what we decided to run this study. So coronavirus, we know, has had a huge impact on multiple sectors throughout the globe. We have run several studies on the impact of coronavirus already and just general concerns over coronavirus, which you may have already seen and you can find on our website. And then for this study, we wanted to focus specifically on the economic impact of COVID-19. So you can see the World Bank has already predicted the largest global recession in 50 years due to coronavirus. In Sub-Saharan Africa specifically, growth is expected to fall to negative 5.1% this year, and Sub-Saharan Africa is also expected to go into the first recession in about 25 years. And sectors including especially tourism, retail, and other sectors are expected to take several years to fully recover. So with this study, we really wanted to look at the on-the-ground impact of coronavirus on employment, income, ability to pay expenses, and just general concerns. We also looked at loan usage and mobile money usage in this study. So Geopol is a mobile research firm. We primarily run surveys through mobile modes, including SMS, voice call through computer-assisted telephone interviews or CADI. We also conduct studies through mobile web and mobile application. And so why do we focus on mobile? It's really because this is such a growing sector in Sub-Saharan Africa. So we have 747 million people with SIM connections in Africa, and 50% have access to a basic mobile phone. So that means they can receive SMS or voice calls. And we can see that by 2025, 87% will have mobile broadband connections, meaning they can have links and use mobile applications. And I see Ricardo has joined. So Ricardo, do you want to start off?
Yeah, sure. Thanks, Roxy. Well, I don't know how far we've gotten, but oh, there's the slides on the screen. Sorry, we're having a bout of load shedding here in Johannesburg. Those of you from Africa, I'm sure you're pretty familiar with the challenges. Yeah, I just wanted to start by saying, before I get into a little bit about our business, is this is a study that's been very close to a lot of our hearts. Something that's been on the minds of many is whether this economic impact of COVID-19 is actually going to be proving to be more, deadly than the actual pandemic itself. It's really battered the global economy, causing quite a serious recession, the worst we've seen in about 50 years. And even though it will be this new economy, there's certain levels or certain industries that just won't go back to the levels of output that we had before previously. If you're a poorer country that just doesn't have the capacity to provide the kind of fiscal and monetary support on a scale that the advanced economies have done, the effect to human life can be massive. So, I mean, even in the advanced world, it's interesting that countries that have not locked down nearly as rigorously are experiencing similar levels of economic impact. A case in point with countries like Sweden, that has not had a formal lockdown, has seen its economy shrink pretty much to the same amounts that neighboring Denmark has, with a much tougher lockdown. And that's because people's behaviors are starting to change and have drastically changed. That decreases this economic output. No one is spending money, they're all staying at home, and attitudes are consistently changing. So, Geopol has embarked on this series of studies to really understand the effect the pandemic has had on individuals. This part of the study is the effort that's made really possible by the technology and our DNA of being Africa's largest mobile research platform. We have roughly about 5 million profiled respondents. We acquire these users through long-standing relationships with our mobile network partners across the continent. We are able to index these users continually over time, collecting lots of pieces of metadata about them and allowing very, very hyper-targeted surveys and done all at scale. Just last year we completed 10 million plus interviews, and we have a total accessible database of around 250 million subscribers. Some of the advantages of a mobile methodology, it's multimodal, so we can really employ specific modes to account and accommodate for the data collection challenges that we have per country. In cases where literacy rates are low, we would do telephonic interviews and be very inclusive to those who cannot read or write. In countries that have higher internet penetration rates, we are able to utilize mobile web, disseminating rich media to respondent profiles. The basic lowest common denominator being SMS also cuts through a good portion of the SEC classifications per country. We can use or employ app to account for the top or higher SEC brackets. It's all remote. I don't think I need to stress the importance of that during this time of the pandemic. Our business has seen drastic shifts because of this. A lot of the traditional data collection mechanisms of face-to-face have, drastically had to be rethinked, and essentially this has seen us having to adapt to the growing needs of our customers. It is representative. It's, I think Roxy, before I joined, ran through exactly the penetration and the proliferation of mobile devices across the continent. This is a very easy way to collect and reach consumers stretching from widely spaced geographic locations, as well as, like I mentioned, cutting across different income groups. And because we are able to build this intelligence over time, the surveys in our database does become hyper-targeted, allows us to really include a sampling frame that is extensive and allows for a specific audience profile to speak directly to them and collect that data. Thanks. I'm going to hand over to my colleague Caitlin, who I think is just going to talk about the methodology before we get into the results. Take it away, Caitlin.
Great. Thank you so much, Ricardo, and hello, everyone. So now diving into the methodology, as Ricardo already mentioned, we have a very powerful tool, which is our SMS tool to collect data, and that is the tool that we used to collect our financial impact results. And really what's amazing about this tool is the fact that we can access respondents who own a variety of different phones, allowing us to engage with a larger target audience and allowing us to get to very remote respondents across Africa. So how our SMS technology works is that we're able to engage with respondents who have very basic phones that only accept text messages or calls, feature phones that have access to the internet, and lastly, smartphones. We have already seen a very big shift in the demand for mobile and online data collection tools, and it's great to showcase the power of mobile research to stay connected with respondents during this time that is allowing us to be remote and safe at the same time. So how does a respondent engage with an SMS survey? Well, we send an opt-in message via text to a respondent, and they will respond with a code associated to their answer. So it then becomes a two-way conversation between the respondent and us, sending one question at a time. For these surveys, we ran from the 11th of June till the 6th of July. And it's important to note that majority of the countries that we targeted were still in lockdown or entering a phase of reopening. But many had already been impacted by the pandemic, and you'll see this in the results. Now looking at the profiles we achieved. So Ricardo already mentioned this, that we have partnered with local mobile operators across Africa. So using our own mobile subscriber database in each market, we targeted respondents who were 18 and older across Ivory Coast, Nigeria, Kenya, Mozambique, and South Africa. We then managed to achieve a sample size of 500 respondents per market. So in order to achieve a nationally representative sample, we did set quotas on age, gender, and location. We then decided to also include income. And as you'll see, it's a very text-heavy slide, but just to explain how we came up with the income breaks, we did work with local partners to decide on which income distribution breaks to use, as you see above. And underneath each local currency, you'll see we have provided the USD equivalent. We didn't apply any quotas here, but so we decided to let the monthly income distribution fall out naturally. But you'll see that majority of the respondents are filtered in at the lower income breaks, from 53% sitting in Kenya, 70% sitting in Mozambique, 67% for Nigeria, 55% for South Africa, and 72% for Ivory Coast. And this is to be expected when using our SMS database, as we do tend to see a skew towards the lower income distribution. We then decided to ask respondents various questions around the sector that they work into. And we know that many sectors have already been impacted and layoffs have already occurred. So we first wanted to get a sense of how many respondents were employed before COVID, and we found that 53% said that they were. Then out of that 53%, we decided to group respondents into informal and formal workers based on the sectors that they previously worked in. And roughly we get an even split between informal and formal, with 48% falling within informal workers. And this comprises of farmers, sellers, construction workers, transportation workers, cleaners, beauty services, and more. And then we have 44% falling within formal workers, and this makes up educators, government workers, healthcare workers, and larger businesses. So diving a little deeper into the employment change, so here we decided to ask respondents, okay, you were employed before COVID, now are you able to work? And 60% of respondents say that they're unable to work currently. And we found that this number was highest in Nigeria and Ivory Coast, but lowest in South Africa. Looking at the formal workers, to be expected, education has been greatly impacted, with 80% of educators not being able to work. During the time that we sent out these interviews, many schools across Africa were still closed or slowly opening, allowing for certain grades to return. Out of the 34% who are able to work, healthcare providers make up this, with 49% continuing to work. And we expect that healthcare workers are obviously still employed, still helping, still fighting this battle that we're all experiencing. Larger businesses were not impacted as significantly as smaller businesses, with only 47% of large business employees being unable to work right now, compared to 68% of smaller business owners. We do expect there to be a big impact on small businesses and entrepreneurs, especially during this time, and we're already seeing this. Looking at the informal workers, any type of construction work has been heavily impacted, with 76% saying they're unable to work, followed by people who work in the beauty sector at 70%, as well as transportation sitting at 65%. Then on a more positive note, agriculture has been impacted, but not as drastically as the other sectors falling in the informal workers, with 45% of farmers still being able to work during this time. Now taking a look at how employment has changed. So of the 60% of respondents who are unable to work, more than half have a job to go back to, which is very promising for the economy across Africa. 30% of respondents are unsure if they have a job to go back to, and this is really a little unsettling, as people are now waiting to hear if they have a job or not. They are not yet unemployed, but are not being told if they should be seeking employment elsewhere. There are a number of factors that might be impacting this, such as the government not allowing certain sectors to open, or it could really come down to employers not being upfront via communication with their employees. So we're hoping that this percentage decreases, and those respondents are able to have a job to go back to once economies start opening up across Africa. Looking at the formal and informal split, 70% of formal workers say that they will have a job to go back to, compared to 46% of informal workers. This really highlights the hardships that will be experienced by informal workers such as farmers, traders, and others who do not have formal employment. We then decided to look at the impact of income. So this chart is kind of looking at whether or not a person's income has changed as a result of COVID. So we asked respondents if their income has increased a lot, increased a bit, there's been no change, decreased a bit, or decreased a lot. And overall, we see that 79% have seen their income decrease. Out of that 79%, 88% of informal workers have seen a large decrease, compared to 63% among formal workers. Transportation workers especially have seen a big decrease at 74%, while government and healthcare workers have really seen no change in their income. It's a common theme that those respondents with disposable income were impacted the most, with 79% of respondents in the lowest income bracket seeing their income decrease since COVID, compared to higher income breaks. As already mentioned by Ricardo, Roxana, the World Bank is expecting the economy in Sub-Saharan Africa to decrease by 5% as a result of COVID, and we're already seeing this impact. I'm now going to hand over to my colleague Joy, who will take you through the rest of the results.
Thank you, Caitlin. As you can see from this slide, concern over being able to pay expenses is extremely high. Over 70% are more concerned with paying their day-to-day expenses now than they were before COVID-19. And 62% were not just concerned, they were very concerned. And concern was also skewed amongst the lowest income bracket. And across the countries, it was highest in Mozambique and South Africa, 80% in Mozambique and 75% in South Africa, and it was lowest in Kenya. So we sought to find out how do they prioritize these expenses that they are so concerned about. And as you'll see in this slide, food is the highest priority, as you will see in the horizontal bar below the icons in the dark blue length, which shows you how much of a proportion food is how much of a priority food is when it comes to settling the expenses. Food also topped each country, and especially in Mozambique and in Kenya, it had a higher proportion of people who said that it was a priority. And just looking at a recent report by the United Nations Food and Agricultural Organization, 45 million people globally, especially in Southeast Asia and Sub-Saharan Africa, which is where we did the survey, have been driven to food insecurity already. And the reasons for this are that are the disrupted food supply chains, which actually affects the flow of commodities and trade. And the other thing is loss of employment, as we have seen as a result of coronavirus, and also other existing humanitarian crises. These are some of the things that have really driven food insecurity in sub-Saharan Africa. And what we'll see is that rent follows as a priority for paying expenses, as you will see the horizontal bar at the bottom of the icons, the second blue shade, the light blue shade. It also follows as a priority for paying expenses, and it makes a lot of sense that food and rent are the priority expenses because they're the most basic human needs. And when you look at the proportions of the other expenses like school fees, home loan, medical expenses, vehicle loans, credit card, and other expenses, you'll see that they actually have a low priority. So we sought to find out, how do they pay for these expenses? So we'll see that half of the respondents that we talked to in all the countries are paying have actually taken out a loan to cover expenses, their day-to-day expenses, because of coronavirus. And this is a result of decreased incomes, job losses, and also high access to mobile money and digital lending. And as most of you may already know, there has been significant growth in mobile money applications and digital lending in sub-Saharan Africa in the past decade. And mobile money has been credited in improving financial inclusion by providing financial services to those who can't open a bank account, especially amongst the youth. And also it gives high access to small amount short loans for business and personal use. And these are some of the reasons why it has had a very high penetration in sub-Saharan Africa. But the challenge with this is that most people are unable to pay their loans because of the high interest rates. So just looking at this, the next slide shows how this varies across the countries and what the alternative ways are of covering these expenses. And what you'll see is that across the countries um, we have the alternative ways are savings and salaries. These are the alternative ways of settling expenses, and they stood out for most of the countries except for Kenya and Cote d'Ivoire, where the highest proportions would settle the expenses using loans. And we also went ahead and asked these respondents how long they expected to pay their basic expenses given their current income. And we found out that almost 40% said that it would last them for less than a month. Only 23% said that it will last for 2 months or more. Looking at the same results across informal workers and formal workers, we see that for informal workers, most of the largest proportion are settling their expenses using loans or followed by their savings. And this is expected because they probably don't have a regular income, and they probably have high access to funding for their small businesses and the type of informal work that they do. But for formal workers, you'll see that the majority, 53%, are actually financing their expenses using their salaries and incomes, which is expected because um, they have regular income. So now that we have talked about mobile money, the next slide shows us how mobile money payment activity has changed after coronavirus. And despite cashless payments being encouraged, you'd actually think cashless payments are actually on the rise. But what we found out is that for the majority, mobile money payment activity has reduced, and this is a result of a decrease in overall spending. And we also found out whether they were able to withdraw or deposit money at a mobile money agent, and we saw that for the majority, they were able to deposit or withdraw money from a mobile money agent, and that's why we ruled out access to mobile money agents as a reason for decreased payment activity. And we believe that it's as a result of overall decrease in overall spending since the COVID-19 pandemic. However, in future studies, we'll be able to compare other forms of payment so that we can be able to get more information on this finding. Now looking at aid, this was very interesting to see that over 80% claim that they have not received any aid. A very small proportion, only 17%, say that they have received some form of aid since the coronavirus crisis began. And of course, this varies by country, because we saw that in South Africa and in Cote d'Ivoire, they over-index, because in South Africa, 21% said that they have received aid. In Ivory Coast, 34%, which is way higher than the average 17% for all the countries. So South Africa and Ivory Coast have seemed to have had a higher proportion of people who have received aid compared to the other countries. And just looking at the example of South Africa and Kenya, I think this will make sense, because in South Africa, the government has committed $26 billion to fighting the pandemic, while in a country like Kenya, the government has focused all its resources on strengthening the healthcare system so that we can be able to deal with similar situations in the future. So what are the sources of the aid that they have received? The next slide shows us that family and friends, followed by the government, are the main sources of receiving aid. In Kenya, Cote d'Ivoire, and Mozambique, they have mostly received aid from family and friends. In South Africa and Nigeria, they have mostly received aid from the government. Okay, now moving to the next slide. What I'd like to say here is that the peak of COVID-19 is yet to be seen in most Sub-Saharan countries. However, governments are very eager to lift restrictions on movement so that they can be able to prevent continued economic collapse. But we've seen evidence of reopening in countries like Nigeria, where the hotels and the churches are reopening, Kenya, where we have a reduced curfew and the county borders were opened. So we sought to examine the citizens themselves on whether the government should prioritize protecting people from coronavirus, or if they should prioritize reopening the economy. And it was very interesting to see that in all the countries, the citizens believe that the government should prioritize protecting people from contracting coronavirus, except for Nigeria, where the majority of the citizens believe that the government should prioritize reopening of the economy. And looking at the same results across formal workers and informal workers, you'll see that we are having a similar trend where the majority of both categories of workers, not the majority, but the highest proportions of both category of workers believe that the government should be protecting people from coronavirus. And this is more pronounced for formal workers. So I'd say that the governments in all these countries are actually in the right direction, because their focus is more on protecting people from coronavirus, and reopening the economy has come in as the secondary thing. So that brings us to the end of our presentation, and I'll hand over to Roxy.
Hi, thank you, Joy. Okay, so we will go into a Q&A in just a minute. So if you have questions, please write them into the Q&A section or the chat, and we'll get to as many as we can. For the full study, it is available, it will be available this morning on Geopol's blog, geopol.com/blog. It'll be the first post. We have a full written PDF, which includes the analysis we've discussed here, and also breakdowns by age and gender, and some more country-specific breakdowns written up. We also have an interactive dashboard available where you can actually filter yourself to different populations, and that is also available on our website. So we'll now go into a Q&A. So the first thing we wanted to ask, and perhaps Ricardo and Joy could answer this for sort of looking at South Africa and Kenya, what are some of the biggest takeaways from this data that you see as your governments look to start reopening? Maybe Ricardo, you could go first.
Sure. Yeah, something I just wanted to draw attention to was the access, or the difference between formal and informal workers and their access to funds to cover their expenses. We had this, overwhelming favor of the informal workers that were utilizing loans to cover their expenses. And this, I think, is just adding to this massive debt trap that we see so often, where the middle class and the upper class, they continue to kind of just survive on their kind of positions in current steady employment, whereas your informal sector is potentially going to get set back by many years with any kind of predatory lending that might be going on. So it's just, it's something to draw a conclusion to, but also disheartening at the same time. I think as an emerging market, we are faced with this challenge in terms of whether it's borrowing from global banks or even within our societies borrowing from our local banks. It's normally the informal sector that is hit the hardest.
Okay, just to add on what Ricardo is saying, I think digital lending has played a very critical role, especially during this pandemic, because it has enabled people to access food and shelter, which are, as we have seen from the presentation, are the priority expenses and the main concerns that people have. So it's actually played a critical role in helping people access food and shelter. But at the same time, the challenge remains, as Ricardo has just mentioned, that people are not able to pay back these loans, and especially looking at the fact that they were not able to pay back the loans before the pandemic. And now we're in the pandemic and the incomes have reduced, and people are going through job losses and unemployment, and they're still taking up loans so that they can be able to access their most basic needs. So I feel that it has actually played a role on both sides, where it's played a critical role in helping people access their needs, but at the same time, it's left people in a debt trap because they're not able to pay for it. The other key takeaway I'd say is that the government, as we've seen, very few people are claiming to have received aid. And in a country like Kenya, we've seen the government saying that they have allocated a lot of resources where they're going to be sending people money on M-Pesa. And we've had cases where we have seen citizens in Kenya who are in middle class and who have cars, and they're saying they've actually received the government money. So I think there needs to be that clarity on how the government is selecting the people that will receive that aid. And as they give that aid, the priority should be on food and shelter, because this is what people are most suffering from. I know I've spoken a lot, but I also just wanted to give an example in Kenya, where we have so many people who we see in the news daily, who the roof to their house was removed, their window or the door was removed because they hadn't paid rent. And every month we usually get increasing statistics of Kenyans who have not been able to pay rent. In April, it was 30% of Kenyan households had not paid their rent. So I think government should actually prioritize helping. When it comes to aid, their priority should be balanced between strengthening the healthcare system in Kenya and also providing food and shelter for the citizens in Kenya.
Great, thank you, Joy and Ricardo. We have a couple of methodology questions, which maybe Caitlin can help answer. One is around how many questions you can do in an SMA survey and how long do the interviews take? And this, Caitlin can speak to it a bit more, but this survey did include about 25 questions plus a few demographic questions. And then also, how do you make up for the populations that don't have access to mobile phones? So Caitlin, if you want to go into a bit more detail on those items.
Sure. So for SMS and when we're sending individual questions, we do recommend that we keep the survey as short as possible. So a good indication would be to kind of keep it to 30 questions or less. And as Roxanne already mentioned, for this specific survey, we asked a total of 25 to 30 questions. Not everyone answered every single question. We did have a question around about if people were unemployed already before COVID or students. They then branched out and answered many of the expense questions that Joy covered in her section. So keeping it short would definitely help with response rates. A 30-question survey on SMS shouldn't take longer than 15 to 20 minutes because we generally keep the questions very simple. They're not complicated. They don't have a lot of answer options because we don't recommend having very long brand lists or associations when we ask respondents. So in Africa, we see that the mobile penetration is very high. Majority of respondents do have a mobile phone. A mobile phone is mainly their sole digital device. They don't necessarily always have laptops or tablets and things like that. So we do feel that when we use our SMS methodology, we do get a nationally representative sample of respondents. But of course, with any methodology, there are some limitations. If you do want to go very specific and very niche, and you want to get a very specific region or city or rural area, and obviously older respondents, we would then recommend either going CATI, so telephonic interviews, or go face-to-face. And we do have those capabilities. Obviously now we're not running any face-to-face research, but we can still run telephonic interviews as we have call centers across Africa, and our call center colleagues are working remotely at home. So that is another option. So you could even go and use a mixed modal approach where you use SMS as well as CATI or CAPI to supplement any kind of specific demographics that you're looking for that SMS can't target.
Great, thank you, Caitlin. I see a couple of questions on if the data can be used for governments to make decisions, or if governments will be making decisions based on the data, if we can compare potentially the amount of aid governments say has been provided versus how much aid people are actually getting. And also if governments are doing enough to cushion their citizens from the poverty that is going on because of this. So just to answer that, we just had that one question on government's priorities within this specific study. Our previous two studies on coronavirus, which were run in 10 and 12 countries, did ask some more questions on trust in government and government ratings. So I would recommend you look at those, which are also available on our website. And that was quite mixed. That was right at the beginning of the pandemic, and we did see fairly low ratings for government actions when we ran those surveys, which were in March and April. And in terms of government using the data, we have not shared it yet, but we will be making this data available on the Humanitarian Data Exchange, the raw data. You can also email us at info@geopol.com for the raw data. And we know that from our previous studies, quite a few agencies have downloaded our data and used it for a couple of academic papers and other resources. So we certainly hope that they do, but so far we've only just released this data, but we certainly encourage it to be shared with different sources. For another question, and maybe Joy, you could answer this. Do you think that the mobile money activity declining is potentially because people are sheltering together with their families rather than sort of going to different areas to work and then sending money home? Or do you have any other thoughts on why the mobile money activity may have been decreasing?
I think when it comes to mobile money activity decreasing, it's more related to economic activity, which could actually be indirectly linked to what you've said. But in a country like Kenya, we've seen a lot of limited movement. For example, we have the curfew from 9 p.m. to 4 a.m. every day, meaning all the economic activities that were happening later into the night have been cut off. And we also had the borders being closed for Nairobi, which is the key economic hub for Kenya, Mombasa, and a few other areas, a few other towns in Kenya. So I think I'd mostly link it to the reduced economic activity, specifically in Kenya, more than families traveling to shelter together in one house, because there was a lot of limit on the movements.
Great, thank you, Joy. And there's another question on the covering expenses point between the informal and formal, the differences there. We saw that informal workers were relying more on both savings and loan than their income. So there was a question on, is that because they don't save as much and depend on their salaries, or they have low savings habits? So Ricardo, maybe you could answer why you think there's that difference between informal and formal on how they're covering expenses. Or Caitlin, if you want to answer that as well.
Okay.
Yeah, go ahead, Joy.
Okay. Yes. Yes, I think it's because, like we mentioned during the presentation, when you look at formal workers, in the type of work that they do, they may not have a regular income. But somebody who is in the formal workspace, they have a regular income. They know on a specific date of every month, I'm going to be getting a salary or some type of income. So they have actually built dependence on it, and they've tagged most of their expenses to it. So I think that's why we are seeing that clear difference. And also the fact that the people in the informal workspace, most of them are dealing with small businesses or micro businesses. So they've probably developed those channels for getting informal funding or micro funding for their businesses. So they're probably able to get credit for their businesses, and from that they're able to get some money which they can also use for their families. So that higher access to credits that they may have compared to from people in the formal workplace.
Great, thank you. Ricardo, did you have anything to add there?
No, I didn't have anything to add. I wanted to reply actually to the question regarding school fees as one of the top priorities to cover expenses. Interesting. This is something I think further investigation would be needed to actually see what the government's protocols were in terms of school fees, because I know in South Africa there's been no refund on school fees, and parents failing to pay school fees specifically at the model C type schools and private education run the risk of not having their children being able to go back in this academic year. So I think, you know, maybe I would suggest you have a look at the dashboard results and actually specifically drill down into those results per country regarding the priority to cover the school fees, and you should see Kenya versus a country like South Africa having completely different results. If your government is saying that you know, school fees will be covered during this time, then obviously it won't be such a concern for the Kenyan population.
Yeah, thanks for that, Ricardo. There are also a couple of questions on why we chose these countries and if we have data available from other countries. As you saw from our map at the beginning, Geopol does work really throughout the globe, but with a lot of our projects being based throughout Sub-Saharan Africa, we chose these countries just because they all are sort of economic centers and in different regions of Africa. So we felt we could get a good idea of how the economy is doing by looking at these 5, but we do run studies regularly in a lot of other countries. Countries including Tanzania and Zambia were included in our earlier studies on coronavirus, and there is data available from those, which had a couple of questions about the economic impact and concern over the economy, but they were more on those studies focused a bit more on if people were self-quarantining, what actions they were taking to protect themselves, and some other questions like that, which were more relevant towards the beginning of the pandemic. So yes, we do run studies in all of those countries. For this one, you know, in order to get the data quickly, we just decided to focus on these 5 so that we could speak to them more specifically. There's also a question about youth and how the youth will be most affected by the pandemic from an economic perspective, and how governments can elevate the youth population from the problems. And I would definitely recommend looking at the dashboard and also our full report, which we'll be sending out, since it did have some comparisons for different age groups. And the dashboard, you can look fully at all questions compared by age group. We did find some interesting changes. The youth actually were more likely to say that they would prioritize protecting people from coronavirus versus reopening the economy. So that could indicate that they are perhaps concerned about their parents or older generations, so they actually still prioritize protecting people, or perhaps they're following the news more closely than some other age groups. So there were some interesting differences there. Joy, do you have anything to add on specifically the youth populations and how you think they might be impacted?
No, I actually had the same thoughts in mind when you see that question, because what we see is that people who are 26 years and above were more concerned about the reopening of the economy than people who are 18 to 24-year-olds, who are more likely to be in campus, still dependent on their parents. So I think it's affecting the older age groups more than it is the youth.
Yeah, and you can also break down our data by employment type. So we did find a quite large portion said they were already unemployed before the pandemic, and also said they were students. And of course, that lowest age bracket had the highest percent saying they were students. We also asked about expense responsibility. And again, the lowest age bracket was less likely to say that they were responsible for their household expenses. So there's certainly a lot of other cross tabulations that can be done with this data. There's some pretty interesting findings there. And we also had one question about the income level and if we had targeted this to lower income respondents. And perhaps Caitlin, you could explain how this was targeted with the different demographics and the income.
Sure. So as I mentioned earlier, we focused on 18 respondents who are 18 and older within each market. And then we applied specific age quotas. We then also applied a gender quota, and that's why we achieved a 50% split between male and females. And then we also focused at a provincial level for location so that we could get a nationally representative sample across age, gender, and location. For income and socioeconomic statuses, we decided not to apply any quotas and let that fall out naturally. And for income, as we already saw in the table that I chatted about, we did see a large portion of respondents falling within the lower income breaks, and it almost like tailed off to respondents in the high income breaks, falling in at a lower percentage of around about 3 to 5%. So generally how we create our sampling frame at Geopol, to give you an example, in South Africa, we have access to over 10 million mobile subscribers. We then will run simple random sampling to select the respondents we're going to target. And because we already have demographic profiling such as age, gender, location. For South Africa, we have ethnicity. We're then able to target respondents within that sampling frame using simple random sampling, so that we're getting a naturally representative sample, as well as natural fallout within those markets.
Yep. Thanks, Caitlin. And yes, in terms of if it's skewed on the lower side, it's a bit hard to tell because there's a lot of varying estimates in terms of average income per country, but it did line up with some data that I had seen from Ipsos, which suggested in Kenya, for example, about 80%, I believe, were under 200 or so USD a month, which is quite similar to what we found. And we also did want to get more informal workers. So the International Labor Organization estimates up to 80% of the population in Sub-Saharan Africa is informal workers, and our sample was about 50% were informal. And we do also collect living standard measures or socioeconomic class information for certain studies, so that you can get another measure. For this one, we decided to use income. Okay, the only other question I see is around some of our samples. If we have B2B sample, we mostly focus on general population, but you can always email us at info@geopol.com or go to our website, and we're happy to respond to any more specific questions about our sample. I think we've answered most of the questions, so can wrap it up, but I want to thank our panelists, Ricardo, Caitlin, and Joy, for doing an excellent job at going through the results and giving us some insights on what they mean for the economy. And we will be following up by email within the next day or so with the link to the full report, and please feel free to share that around. And you can also email us at info@geopol.com to request access to the raw data set if you'd like to do your own analysis on this data, or if you have any additional questions that we have not answered. So thank you again, and thank you to our panelists, and thank you all for joining.